the COVID-19 pandemic has had a profound impact, I think, on women. If you look in many of our countries, especially when I look at some of the data in Africa at the who's infected, quite often you see that many more men than women are infected. And I think that reflects who's out there being exposed. And quite often it's kind of young, in the young age group, it's young men who are involved in business and whatever, and people who get ill and they recover. But the impact, if you look at the impact on women, first, if we look at health workers and people who are in the kind of occupations where you are exposed to risk, the majority of caregivers and healthcare workers are nurses in our region and are women. So many of the people who have become infected have been women, or many of the people who have been put at risk. And the impact on healthcare workers is not only those who become ill or those who have died. Feeling confident that you are safe at work has not been guaranteed to many of these women. People have had to be taking risks. And so the worry, when you're talking to healthcare workers, the concern that you may get infected and you'll take this virus back to your family, back to your home. That's been a huge worry and kind of a burden emotionally on healthcare workers, many of whom are women. And secondly, there's been stigma. People have been afraid. You work in a place where you're exposed to this in the neighborhood. People are worried about you being a source of infection, not only to your family, but to them as well. So there's been a sort of suffering quietly, I think, by many healthcare workers, doctors, male healthcare workers too, let's be fair, but many of the people concerned are women. Women are caregivers not only in hospitals, but also in the home. The people who will be the primary caregivers, family members falling sick and being responsible for protecting other people, organizing that, generally tend to be women. So I think even that responsibility has been an impact. And then if we come and look at the economic impact of the pandemic, the people who have suffered the most are those who are working, one, in the informal sectors, those who are working in the service sectors, those who are working in the personal services sectors. A very huge proportion of those are women as well, where people who are working as domestic workers, where the first concern would be, oh, no, these people are going to come into the house and bring in the virus. In many countries, the first people to lose their jobs were people who work as domestic workers, don't come, and very often don't come means then I'm not going to pay your salary. People's income just got cut. And many of the people involved in informal markets, selling various goods, are also women. And then health-wise, it's been huge. So the lockdowns, we know, had a big impact in terms of upticks in gender-based violence, where people who would normally, if they're in relationship where violence is a feature, during the day would be out. So the combination of the frustration of being locked up in some of the countries, the impact on incomes of these men just, I think, exacerbated those situations. And certainly they've been increased in gender-based violence, increased in sexual abuse of young women, increases in unplanned pregnancies among young women. Of course, the fact that access to health services was also limited by the lockdowns meant that access to family planning services dropped dramatically in some countries.